My name is Dirk Laubscher. I've been a physiotherapist for over 11 years. I'm the owner of a health clinic in Harley Street in London called Rejuve Limited. And today I'm going to give you guys some tips and advice about neck pain and associated conditions. How to relieve upper back and neck pain. Upper back and neck pain is very common. It's probably one of the most common conditions that I see at the clinic. It's just because the upper back and the neck, they're basically directly connected. So that's a very common and problematic area. To relieve the pain in that area, we have to look at your posture, how you're sitting, how you're walking, how you're standing, how you're sleeping. That area is put under a lot of stress for people who do a lot of sitting, computer work, reading, writing. And again, what happens is that the joints in the back stiffen up, which causes the muscles to tighten up, which causes the pain that can radiate from the upper back into your neck. To treat that, we have to correct your posture. Make sure you're sitting correctly, you're sleeping correctly, you're walking correctly. Make sure at work that your desk is set up correctly. That you're not hunched over when you work, but that you're upright. Your head is on top of your shoulders, it's not leaning forward. And then to see a physiotherapist is a great idea because we work on the muscles. We can do deep tissue massage, trigger point massage, dry needling, spinal mobilization and manipulation. It's important to understand that massage, for example, alone will only give you short-term pain relief. And if that's what you want, then that's okay. But if you're looking for something more sustainable and a long-term solution, then you have to look at proper rehabilitation, where we actually strengthen the muscles of your back and your neck as well. So just to recap how to relieve upper back and neck pain, firstly we have to correct your posture. The way you sit at work especially, how your desk is set up, are you leaning forward, where your computer sits. It's called an ergonomical assessment. That's very important. Also the way you walk and the way you stand, how you keep yourself, where your head is in position to your shoulders. All that needs to be corrected. You can also get soft tissue treatment, massage, deep tissue massage, spinal mobilization and manipulation. And then it's very important that you do postural correction and strengthening of your postural muscles, because that's the thing that's going to, at the end of the day, give you a long-term solution to your back problem. And that's how to relieve your upper back and neck pain.